The following program is a paid presentation for the Plastic and Cosmetic Surgery Institute and is brought to you by Dr. David Watts. This program contains medical images that may not be suitable for younger viewers. Parental discretion is advised.
Good evening and welcome to Plastic Surgery Issues and Answers. I'm your host as usual, Dr. David Watts, and if it's Wednesday night and it's 7:30, you know it's got to be Plastic Surgery Issues and Answers. This is the longest running plastic surgery show in these United States. We've been going for 19 straight years and we have 19 more to go, so we're happy to be here tonight. It's a beautiful August night. Can you believe we're into August already? And we would love to hear from you tonight, what's going on in your lives in the summertime, what's happening with plastic and cosmetic surgery, what you're thinking about, how the summer's been for you, all those kind of good things. And if you'd like to call in and speak to us, the number's listed on the screen at area code 866-472-8868. And we can't wait to hear from you, and we can't wait to talk about plastic surgery. Now, what can we talk about tonight? Liam's going to get the different things that we do up on the screen, and here we go. We can talk about facelifts. One of the things that we've been doing quite a bit of is the mini facelift in conjunction with the filler injection. So we do a nice little mini facelift. We can actually do some liposuctioning of the chin, the cervical mental region in this area, the jowl areas, and then inject the fillers into the nasolabial folds, the marionette lines. And with that, we've gotten great results. We've done quite a few brachioplasties, which is the arm tightening for those bat wings. And we're doing a relatively new procedure called a mini brachioplasty, where we don't have to make the long incision down at the arm. We just tuck it underneath, and that's the mini. It puts a little incision underneath of the armpit, and the beauty behind it is that all of the hair-bearing skin and glands are removed, so no more deodorant and no more shaving for the ladies. So the mini brachioplasty is a great one. I think some patients just sign up just so they don't have to shave or use deodorant anymore, so that's something to think about. Tummy tucks are always in vogue. We did 2 of those on Monday, and that's always exciting and fun. Breast augmentation, we saw 2 or 3 consults for breast augmentations last night. Rhinoplasty, nose reshaping, that's always a big one. Liposuction, that's a mainstay. Otoplasty, which is tucking the ears back. Paniculectomy, which is the large tummy tuck where you have all of the excess skin hanging over. And now you're talking about skin that really hangs down past the pubic area. Many times we can get that approved through insurance for you. Blepharoplasty, which is the eyelid surgery. We do the upper lids, we do the lower lids, and we also do the brow lifts. And last but not least, the Brazilian butt lifts, and that's where we actually liposuction, process the fat, and then inject it back into the buttocks. We also do hand surgery, facial fractures. We just had a jaw fracture last week where they had a fracture of the jaw, both 2-part, right here in the parasymphysis and the back at the angle of the mandible, and we took care of that. But before we get into any more of that, the phone lines are lit up and we're ready to go. And our first caller tonight is Donna. Donna, how are you, my good friend?
I'm fine, thank you. And yourself tonight?
Oh, I am doing absolutely outstanding. How's your summer going?
It's not too bad. It's not too bad, considering I've had a couple of little surgeries and I've had a tummy tuck, so I'm trying to get out and enjoy what I've had.
Good for you. Good for you.
Thank you. I have a question for you, though.
Sure.
The plastic surgeon that I use, I need to have my arms done with, I think you call it a brachioplasty?
Brachioplasty, yes.
Okay. which you did touch on when I called. He only does it where there's that long scar. Mm-hmm. And I heard you say that you do it through the armpit and you tuck the skin underneath the armpit.
Correct.
Can you just elaborate a little on that for me?
Sure, Donna. Great question, and you hit on it. There's two ways to do it. One is the traditional brachioplasty, which your plastic surgeon talked about, and that's where we make the incision right here in the bicipital groove, and then also a vertical incision in the armpit. So we tuck it in two directions, again, horizontally and then also vertically. One of the other things that we can do now, and it depends on how much sag you have, is that we can do what's called a mini brachioplasty, and it's basically a baby mini brachioplasty or arm lift, and we don't have to put that incision down here on the horizontal component. We only do the vertical and just tuck it in the armpit. Now the question, Donna, is what constitutes the ability to do the mini over having to do the full? It's all based on the distance from the mid-humeral line, and the humerus is the bone in the arm. And if you drop a line down, straight down, and you measure this distance, if it's less than 10 centimeters, and you can take a centimeter ruler and measure from this point down. If it is less than 10 centimeters, you can do the mini, where we just tuck it up under the arm. If it is over 10 centimeters, then you need to do the traditional, where we do the horizontal and the vertical component. So here you go right here. If you take a look, you can see this is hanging down. This patient had more than 10 centimeters, and this was one where we had to do the traditional brachioplasty that had both the vertical and horizontal component. Great question, great question. All right, our next caller on the line is Dixie from Dover, Delaware. Hi, Dixie, how are you, my friend?
Hi, I'm just fine. I have a question to ask you because I can't seem to get any answers.
Sure. Well, let me see what I can do. I'll take a crack at it. Go ahead.
Okay. I had plastic surgery done almost 3 years ago in September.
Okay.
I went back to working out, was released to go back to working out in November of last year. I have developed a swelling on the right side of my abdomen, which has now, since November, gone from my lower right abdomen down into my thigh and into my back. I can actually look like I'm pregnant only on one side of my body and can seem to get no answers from anyone. Do you have any insight for me?
Yes, let me ask you some questions. Have you had an ultrasound or a CAT scan to look at the areas?
They done an ultrasound on me and they said they found nothing.
Okay. Did they get a CAT scan?
No.
Okay. What I would do, Dixie, is I would get a CAT scan, and for a couple of reasons. One, we need to find out if the fullness or the protrusion in your abdomen is related to, one, your intestines, and two, is there anything going on with the abdominal wall? Now, the thing of it is that the ultrasound will show, and I'm sure what your doctors were looking at and what my first thought was, is did you have a fluid collection? Because one of the things that you can sometimes have is actually a seroma cavity or fluid collection under the tummy tuck. Because what we do with the tummy tuck is that as we lift up the abdominal wall like the hood of a car and then we pull it down, sometimes the abdominal wall does not stick back down to the muscles, and you can have a little pocket, okay, where that fluid will build up, and that could produce the bulge on one side that you're talking about. However, the ultrasound should display that, and it should show if there's actually a fluid collection in the area. Now, the thing that's unusual when I'm listening to you is the fact that this protrusion that you're having is actually tracking down the thigh, you said, correct, and then into the back. This would be very unusual from a tummy tuck in and of itself, because the tummy tuck is only addressing the abdominal wall. That's why I would get a CAT scan that would look not only at the abdominal wall, but will look at the intestines. It will look at your back because you will see the cuts of the CAT scan that will examine what's going on your back. And then I would even take it farther, Dixie, on this one. I would actually even take the CAT scan down into your thighs to see what's going on. And with the fact that it's only on one side, I would want to look at the musculature in your thighs and see what's going on with that. I would like to see what's going on with the intestines, so I would do this with what we call contrast. And what that means is that they would do IV contrast to look at the vessels, okay, the blood vessels. But I would also have you drink oral contrast, which will then look at the intestines. Now, if you had a bulge on one side, and one of the things that you can sometimes see is that when they go down and they tighten up the muscles on the inside, and it's called a rectus plication, but basically you're taking a pleat to tighten the muscles. If part of that pleat became disrupted or tore, this could allow some bulging on one side. And again, the CAT scan would show that. If you had developed a hernia or something along those lines, again, the CAT scan would show that. The thing that's kind of got me baffled to some degree, and it sounds like your doctors as well, is the swelling in your back and in your thigh. Even if you talked about the thigh, if you had some obstruction of the lymphatics, which are the little vessels that drain the edema fluid or the lymph fluid out of the leg, if they were blocked, that could account for the leg swelling. But the swelling in the back, the thing of it is as you get posterior or toward the back, your ribs actually come along. So it would be very unusual to have any kind of intestinal issues come out through the back because your ribs are there blocking it. So I can understand the intestines in the front, I can understand lymphatics on the leg, but in the back, the only thing that's really back there are muscles. You've got the latissimus dorsi muscle, which is the big muscle that comes across here, and you've seen like bodybuilders that have that big latissimus muscle. Then as you go more toward the back, toward the midline or the middle of the back by the spinal column, you have the erector spinae muscles, which are two big muscles that help to hold you upright. There's really, and I mean, you have multiple other muscles in the back. You have the rhomboid muscles, a lot of different muscles in the back, but nothing that should cause a bulge on one side versus the other. And to just have that, you know, I'm not sure. Let me ask you some more questions. Have you had a workup by your internal medicine doctor to make sure that nothing else is going on with the musculature, either in your abdomen, in your leg, or in your back?
My general practitioner has been working with me along with my former plastic surgeon, with my new plastic surgeon. They have all gotten together and made the decision that they are going to send me to a vascular surgeon and have me checked over thoroughly, because this is something where I am getting a lot of discomfort from, and it only normally happens at night. Now the swelling it's here, and it seems like it's staying. Right now they have me on Lasix. It's working some, but not completely.
What is their working diagnosis, Dixie? I mean, what are they saying that they think may be causing this? What are their thoughts on this?
The general practitioner basically told me that they feel that I was not put back together right. On the right side, the drainage system was not put back together correctly. The doctor that done my lap band surgery also agrees that I was not put back together correctly. The plastic surgeon that done my surgery doesn't even want to talk about it. The new plastic surgeon, he doesn't even know what to say. He's just kind of baffled, as you said.
Yeah, and you know what? Again, I'm just having to go with what I'm listening to you over the phone. But I would have to go with both of the plastic surgeons. I mean, I know that general practitioners saying that they didn't put you back together, and the other doctors saying that too. But The thing that's confusing me about this, and anatomically, meaning the anatomy's just not making a lot of sense to me, if they're only working on, and your gastric bypass surgeon, that's the other one that's made a comment. The thing that's confusing me on this one, Dixie, and where I'm really anatomically confused, is that I can understand, like on the abdominal wall, that if things weren't tightened correctly, or not even that they weren't tightened correctly, they may have been done correctly, but you may have had some disruption. In other words, the sutures may have come apart, or something may have torn. All of these kind of things that can happen. And so as plastic surgeons, we know this, and that would be, unfortunate, but no cause for major alarm. The thing, though, that doesn't make sense to me is, why would your leg be swollen because the plastic surgeon didn't operate on your leg? And why would your back be swollen because the plastic surgeon didn't operate on your back? And, I mean, if you're having a tummy tuck, that's all localized and located in the front part of the abdominal wall. There's nothing that goes around to the back, and there's nothing that goes to the leg on this. And so that's why I'm like the other plastic surgeons. I'm really not sure why this would happen. But again, I would go either to the CAT scan and or an MRI study to be able to look anatomically as to what's going on, because if there's an issue either with the repair or anything else anatomically, it should show up off of a CAT scan. And if the CAT scan is not definitive, then I'd go to an MRI, because that's going to be very sensitive to looking at the muscles in both the thigh and the back. Great question, Dixie. I hope they get things worked out for you. All right, our next caller on the line is Tanya from Pennsauken. Hi, Tanya. How are you, my friend?
I'm good. How are you?
I am doing outstanding. What can I do for you tonight?
I'm calling because I'm 40 years old and I have severe hip arthritis.
Okay.
And I just wanted to know if you thought it would be worthwhile to get a tummy tuck or some kind of liposuction, if you thought it would help at all, and if you thought it would be covered under insurance.
Good question. Good question, Tanya. All right, let's talk about it, my friend. So you have severe arthritis in your hip. Have you ever had a hip replacement?
No, the doctor says he doesn't want to do a hip replacement until I'm closer to 50.
Okay, because you're young and they don't want to have to repeat it. Understood. How big is your stomach? Does it, or your abdominal wall, does it hang over quite a bit or just a little bit?
Yeah, quite a bit. I've had 2 babies, so.
Oh, okay, so you do have some overhang. And when you're just kind of walking around, etc., do you feel that like weight pulling on you, or how is that?
I do, and I have pain in my hip area and down my leg.
Okay, so you feel that the pull on the abdominal wall is actually putting pressure on that hip. You can detect that. Yeah,
Yes.
I would say, Tanya, that would definitely, if you're feeling that the correlation between the hanging of your abdominal wall and your hip are related, and one of the ways that you can tell is, let me ask you this question. If you were to take your hand and put it under your abdominal wall and lift that up, does that help alleviate the pain in your thigh or your hip?
Yes, it definitely does.
Okay, then you've kind of answered my question for me. I think it would definitely benefit. And I really do think that we could work on trying to get this done through insurance for you for several reasons. One, because of the fact that you're able to demonstrate the relief, which shows that this is definitely a medical problem. 2, your orthopedic surgeon does not want to do the hip replacement at this point because they feel you're too young. And this could actually slow the process of you having to get the hip replacement, if at all, if the weight can be taken off of that affected hip. So I would think we would have a very, very strong case. And again, here's a little picture of before and afters on the abdominoplasty. You're probably more than this, but to give you an idea of that loose skin, what we did is make an incision in the crease right above the pubic region, remove the excess skin, reshape the belly button, and I think that that is a really, really nice result. You can see the abdomen hanging out there in the front and then things being pulled down, but that is, in my opinion, a great shape. But the thing that I would say to you is with that weight hanging down, with that weight pulling, that pressure on the hip will really affect that arthritis and really, in my mind, hasten the arthritic process in the hip and the knee going forward to require more than likely a hip replacement. What we could do is take your packet, submit it to your insurance company. We would get supporting letters from your internal medicine doctor, but more specifically from your orthopedic surgeon, actually going into depth about the arthritis in the hip, the pain, the fact that when you lift the abdominal wall off of the hip area, how that pain improves. And I think you would have a very, very strong case to get something like this approved, because this is clearly not a medical issue. This really falls into the realm of, or excuse me, this is not a cosmetic issue. This clearly falls into the realm of a reconstructive and medical problem. So I think you have a really strong case there, and if you wanted to, we would be more than happy to take a look, and our staff would also be more than willing to try to see if we could work on that through your insurance company. The key thing too, and just to make mention to this, when you come into our office, what we do is when you're calling in, we really like to go over what we need you to bring ahead of time. And if you can't get it when you come into the office, we actually give you a checklist of things that we need to get. And we work together in combination with you to try to get the documentation to get this thing approved through insurance. And again, we accept just about all of the insurances. We have 4 office locations in Vineland, New Jersey, Philadelphia, Pennsylvania, Turnersville, and Salem. And the other thing that I want to bring to your attention too is that our staff will actually help you go through the insurance process. And by us being in network with just about all of the insurances, it makes it a much, much easier process to do. We will be in our Vineland office on weekday evenings. We're there just about every weekday except on Wednesday night when we're here, and Saturday mornings. Remember, all of our cosmetic consultations are absolutely free. You can give a call to the number listed below, area code 856-691-0200, and our staff will get back to you first thing tomorrow morning. We will be in our Philadelphia office on September the 20th, and again on Saturday, October the 11th. We will be in Salem on Friday, August the 29th, and again on Friday, September the 26th. And we will be in Turnersville, New Jersey tomorrow on August the 7th, and again on Thursday, September the 4th. So if you'd like to come into any of those offices, please feel free to give the office a call. We would love to hear from you. And again, remember, all of our cosmetic consultations are free. That's really important because I had a patient that came in the other day who had actually been and seen multiple other plastic surgeons, and they had to pay a lot of money just to come in for a consultation to find out whether they were a good candidate or not. We don't do any of that. Our thing is that if you want to come in, you can come in for free for the cosmetic consultations. We don't charge any money. I spend time with you. I go over your case. We go over before and after photographs. We go through specifically the risk and complications and what the plan would be on your case. So it's a risk-free visit. It doesn't cost you anything, and we'd be happy to see you. I do not dump you off on a nurse. I do not dump you off on a cosmetic coordinator, and I do not dump you off on a junior partner or a resident. You get to sit in there with me, and I really take my time. I go through your entire process, and we will really make you feel very, very comfortable and make you feel at home. I try really hard to run on time. Sometimes we're spending time with patients, and it runs into the next consultation. But do know we are working really hard to try to stay on time and get people seen in a very, very timely fashion. So I think that's very, very important to bring out and also to mention, because our entire staff realizes that your time is valuable, and we really want to give you the quality time that you deserve when you come into the office, no matter which office we're in. And what we've done also is we've tried to move the offices into multiple locations to make it easy and convenient for you. And even though we do our surgeries in our Vineland Surgical Center, we will try to see you as much as possible in the other locations which are closer to you if you live close to some of those other offices. So we try to think of everything. Nothing is 100% foolproof, but we definitely do the best we can. Oh, one more thing I want to say. If you're going through your insurance company, it is very important that we have to follow all the rules and regulations so that you don't get in trouble and we don't get in trouble. So if you have a copay, deductible, or whatever it is, we have to follow that. Now the good news is, as I mentioned a little bit earlier, we are in network, which is huge, because you don't have out-of-network fees, you don't have the hassle of dealing with that, and so we're able to take just about all of the insurances, and maybe Liam can list them up on the screen, but we take Medicare, Medicaid, we take Horizon, Blue Cross and Blue Shield, we take Aetna, AmeriHealth, United Healthcare, TRICARE, you name it, we take it. And because we're Medicare certified, we're able to accept all of these different insurances. And not only am I in network as a plastic surgeon, our surgical center is also in network, so you again will not get all of these out-of-network fees, conniptions, trials and tribulations, which can cause you a lot of problems on the back end. On our cosmetic surgery, another big thing, we do not back bill you. So whatever the cost is up front, and we have some of the lowest prices in the areas, you need to know that. And the reason why is because our surgical center is in Vineland, New Jersey. That means that our overhead is lower, and because of that, we're able to keep our prices down. But the price that we give you for the surgeon's fee, anesthesia fee, and facility fee, which we keep as a global bundle, will be what it is. So if we take longer for the surgery, it doesn't cost you any more money. We only have about 30 seconds left, so for everyone who called in tonight, thank you so much. We will be here again next week on Plastic Surgery Issues and Answers. If you'd like to call in, the number's listed on the screen, area code 856-691-0200, and we look forward to hearing from you and seeing you in person. For everyone watching tonight, thank you so much. Have a great evening.